Thank you, Lorenzo. So now we go to start with some important content. When we are thinking of opening this Congress with a keynote speech, and the best we could think of is how we also had the honor to have as the honorary chair of our scientific committee. So I really, really want to thank a very relevant person, and I would like to say a friend of clinical engineering, Adriana Velázquez from the World Health Organization. Please, thank you so much.
Good morning, colleagues. First of all, thank you very much for making this event possible. It has been really great to see you all here and to see that this is the third edition of this initiative, which was initiated. So thank you very much, a million, to all, grazie mille, to all the organizers, because I know it takes a lot of courage and a lot of passion to do these things. So having said that, let me do a presentation, but please, I just want to ask something. Please make sure that you have your iPhones with internet, because at the end of my talk, I will ask for one question. So you would need to be responding on that. Okay, so just give me the time, 15 minutes. Okay, so I will be presenting to you clinical engineers support access to medical devices and health interventions globally. So as it was very well said, and thank you very much, Lorenzo, for your words, because it is really that passion that makes us really support health globally, no? The same as Shankar. Thank you very much on the work of IUPES and IFMBE and all these organizations that are supporting this work today. So first of all, clinical engineers, we have to feel ourselves as members of a healthcare team, healthcare workforce. Then the question is how can you help global health problems? So it's really about each one of us, how can do it individually and collective. So first of all, we need, like one of our top priorities is to ensure medical devices improve patient safety. We know that 4 out of 10 people will be harmed in a health facility. So how can we really ensure that people remain safe when they go into a hospital? Secondly, we need to support all those in the front lines. And these are just some images. And today I want to say I'm very delightful here to be your keynote speaker, but I'm not talking about myself, but I'm talking about all the clinical engineers that are working in these settings. For all of those that do not have the tools, do not have the information, do not have the things to move forward. So how can we do to support all of them? And how can we do to support all healthcare workers around the world? We need to define appropriate devices for outbreaks. As Tom was saying, yes, we're working for Ebola, yes, and Ebola has not stopped, yes, and there are many other outbreaks that are coming, and we need your input for all those infectious diseases that are harmful. I don't know if you know, but 1.1 billion adults in the world has hypertension, and we still have no blood pressure measurement devices to measure all of them. That seems like a trivial thing, and it is not a complex technology, but still it is not there. And then we have 5 billion people in the world. So now 9 out of 10 access basic surgical services. So what can we do to make surgery a safe place? So all of those are examples, but in general, we need to manage medical devices to support the Sustainable Development Goals #3, that is about good health and well-being. And as you know, we have this WHO publication that defined the role of biomedical engineers. But now I put the question here in yellow. What is the role of the clinical engineers, and which competencies do we require? First of all, we need to consider all types of medical devices, not just the medical equipment that we were used to, like CT scanners or monitors or infusion pumps. We need to go across to digital health, to surgical instruments, to single-use devices, to in vitro diagnostics, etc. We need to be able, we are the ones that are here at the end of the chain. So we need to ensure your role to improve access to safe quality medical devices and that they are used safely. So research and development is done by industry, and this should be based on needs. Then we have the health technology assessment people. They sit around the table and they make a decision. They make, for example, the list for reimbursement or procurement, and these are defined in these kind of groups. This is the regulatory agencies that they will define which product can enter the market. And clinical engineers are more here on the needs assessment, the selection, procurement, the donations, installation, inventories, but the safe use, that is like a key area. Operating costs, clinical effectiveness, post-market surveillance, and then decommissioning and replacement. So we are the ones that bring the technology to the hospitals near the patient to make a better use of technologies. So we're here, but we need to work with the regulators, we need to work with the health technology management people, and we need to work with the industry. So we should not work alone. That is really the lesson for this. We should work with other professional organizations, and I'm glad here we can present IUMP, the medical physics, but then also International Society of Radiologists, the architects, the laboratory people, IFBLS for biomedical laboratory services, health technology assessment, and with the industry. We need to work together with all of them. I hope you have reviewed all the books that we have in WHO website, so there are tools there in WHO to help you guide your work. To be knowledgeable of the regulations and intervene, not just to know about them, but also intervene with them, participate in it. Participate in defining what are the things that we have in common with regulations, with health technology assessment, with health technology management, and know the difference between each of them. So clinical effectiveness, but what do we do on the procurement and selection? How could we link with each of these groups? These are exactly the issues. And then to know the clinical environment. Many of us, if we work in paper in an office, that will not really get us where we want. We need to know the clinical environment, clinical protocols, support nursing staff, do teamwork, and provide economic information. So we have to manage the economic information, the technical information, clinical information. And we need to present health technology management message to non-health technology management people. For me, being here, it's great, but it is easy because I can share the information with you, you know about it, we can share it. But what is really challenging is when I was last week in the OECD trying to tell the economists why it is important to measure the prices of medical devices. That's challenging. It is challenging for me to be also in the European Commission convincing and working with the nomenclature of medical devices. It is challenging when we go to a cardiovascular meeting or a cancer meeting, and that's where we need to go. We need to go where the economists are making decisions with regulatory agencies. I was in IMDRF, and believe me, it is not an easy place to be. Hospital administrators, policymakers, clinical nurses. We need to go out. It is great that we gather here, that we get the strength, and then we go out and share our knowledge, our expertise, and convince others of the importance of our work. We need to work on our qualification, our activities, our functions, and there will be an IFMBE working group on CED on this area. What is WHO doing in 2019 and 2020, and how can you help? First of all, in WHO, we have our 3 billion targets. We have more billion people that will have benefits in their health insurance. We have 1 billion people that we want not to be affected by health emergencies, and 1 billion people more for health and well-being, especially older people, pregnant women, etc. We need to work on all the interventions that are needed for universal health coverage and defining access to quality essential healthcare services. And so we're working with the service delivery team. We are working on the technical specifications for different devices. We have these two that we had before, the resuscitation and the oxygen. And hopefully by the end of the year, we will have the blood pressure measurement, the radiotherapy equipment, oxygen delivery systems with UNICEF, and then devices for screening treatment of precancerous lesions. So we hope that you will receive them in the newsletter of November, most of these new publications. And then we're doing the priority medical devices books that I hope you have seen, but it is mostly on all the devices that you need to take care of mother and children's, and then on priority medical devices for cancer care. And now something that is new in WHO is that we're working for everything that you need in vitro diagnostics for laboratories. And that includes, for example, the test purpose, test format, specimen types, regulatory status, prices. So all of these is now are tools that are there so that you can use them, so that governments can use them too. And we're almost like 90% done on this book on decommissioning medical devices. We hope it also will be released by the end of this year. And we really want to thank everybody that has been helping us. And in this one, we're like 80%, but we need a final go. And so we need experts to help us because we need to define all the devices that you need, exactly what Tom was saying, for diabetes patients, for patients that have suffered a stroke or cardiovascular problems. So this will be an exhaustive list for everything that's needed. And we're almost there, but we need to finish this book also by the end of this year. And then the other thing that we're working very hard is on the nomenclature of medical devices. As you know, GMDN exists, UMDNS, UNSPSC, or maybe proprietary ones or national ones. But now we put this in the agenda, and I want to say this happened because of the meeting in Brazil that we had, where we had really a group working and here with Murillo that is present, that it happened in the during that time that we were there in Brazil, we had a meeting with the Brazilian government, and then Brazilian government made a proposal to have the nomenclature. This came all the way to the executive board, and now we want to say that today the solution might come from the country we're in, because the Europeans have decided to select the CND, that's the Italian nomenclature for medical devices, to be the European nomenclature. And so what we will do is we will take the European nomenclature and we'll put it in a WHO platform so that it will become the international nomenclature. And this can serve regulatory, procurement, CMMS, etc. So we put the two steps. The ones in black is we have to do an analysis for member states and member state consultation still this year. But on the orange side, we have the Italian nomenclature that will be revised by the EU, then the EU form the European medical device nomenclature, and then they will provide it to WHO, and then we hope to release this new nomenclature early next year. So these are major things that are happening that will affect absolutely all of us. And then, of course, to participate in the digital health initiatives. As you know, and everybody was talking about it, wearables, clinical decision support systems, etc. So we have all these digital medical devices in hospital and patients, and then we have our analog ones. And then we have digital systems with no clinical patient data. So we really need to work in this area much more and interact with the people that are working in that area. Our plans for 2020, this is just a quick slide. It's the Safe Use of Medical Devices book, the Medevis. So what we want to do is no more books. We want to put an information system. And so we are creating this, and we plan to release the first version in March next year. So it's a clearinghouse of medical devices information. We really look forward to have our 5th Global Forum on Medical Devices, so I'll send the call maybe in the next month, a call to have the venue for the next, and then we would like to have also 2020, 2022, 2024 planned in advance. And then we will have the 3rd essential diagnostic list, and the priority medical devices will be for respiratory diseases. So for all contact, all the information is in the website. Many things have been translated to French, English, Spanish, and even Chinese with the help from our friends. And if any of you want either to request something from WHO, or if you are experts on any of the issues that we talked before, please send your email with your CV to these medical devices at who.int, and we will take care of it. So now, you ready with your phones? We'll have some questions for you. Just please go browse slido.com. Yeah, you're all ready? Okay, so if you go to slido.com and then just choose enter 8999, then you will be all looking into this questionnaire, okay? Then here you have multiple options. What I want to know is if you have used any of the following resources: technical specifications, donation guideline, list of priority medical devices, the Global Atlas of Medical Devices, then there's donation guidance, procurement guidance, the Compendium of Innovative Technologies. So if you have used any of these books, please click on there. The Model Regulatory Framework, the book on development of policies. We have 75 people entering. Thank you. Keep on going. 88 people. Read through all the lists, because maybe scroll down. If you have never reviewed anything, just put none. If you have reviewed other, or you can comment on it. But the health technology assessment books, the role of biomedical engineers. Okay. 134 participants, that's going well. Okay. Okay. Well, I can see that you're not using the books for priority medical devices. That takes us a lot of our work. That is for, like the ones for cancer include things for imaging, for radiology, for laboratories. So I really would encourage you to have a look at that. No? Technical specifications. Okay, then in the count of 3, we will just close this screen and then we'll open another one. Okay, so 1, 2, 3. So thank you very much. We see that at least we're happy to know that you browse WHO website and then you look into the different books there. Now we have a new question for you. No. No, this is not. This is not it. This is not it. This is not it. This is not it. I'm sorry. Yeah. Okay. So now we will do a cloud. Word cloud? So in one word, just we need one word that you input. What topic do you need WHO to develop or advance? Just one word. It could be anything on a topic, procurement, donations, blah, 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 or it could be a process like advocacy or support or blah, blah, blah. So just choose, but do one word and send it. Okay? Wow, this is looking interesting. You can say advocacy too, or anything. Great. Practical, ICT, people, HTM, outcomes, priority, regulatory implementation, education. More. We have 100. Do more. Go for it. I am really glad that you think nomenclature is important, but you can add any other things, regulations, CMMS, education, collaboration, training. More. We have 142. Go for it. Training, that is very important. Recognition. Go for it. What, 164. At least let's reach the, how many people do we have here? Maybe? Yeah. Okay. More. On the count of 3, at least we have to reach 175 that we had before. So go for it. Hey, at least 2, 3 more. Go for it. 173 people have responded. 174. Who's missing? One. We have to make more than, okay. Let's reach 180. Go for it. Yeah? Okay, on the count of 3, we will change the screen. But this is really important. So you want nomenclature, you want training, you want collaboration, regulations, because it is written in both ways, HTM, recognition. Recognition is really important for both of you, for all of you, donations, ethics. Okay, we will consider this, and if you want to input something, you can. And then you have now a third option. What do they have?
It's a question. It's another tab.
Another tab that you have there in your phones, in your, it says question and answer. You can send your questions now. So we're done with this, 181 people. That is very good. Training nomenclature. No, you put it, yeah. And now we will have your questions and answers. So if anybody wants to add any question, send us any question. Education. I think these are coming up. Yeah. There are GMDN and other nomenclatures. Why create another one? In reality, I will just respond very quickly to some of these. The idea is to have an international nomenclature because GMDN is proprietary. We do not have a transparency of how the codes are assigned. It is not, you cannot freely download for a hospital and then have all the codes in it. So that's why we want to go to a global public good that will be the WHO nomenclature. And we can do the mapping with GMDN. That is the thought of it. And Europe, anyway, is going to the European nomenclature, so we will add for them. How can WHO generic equipment training courses? That is a very good idea, and we would like to help, because if we can have training courses that maybe the CD or others can put it in their website, then we can create a link from WHO site to the CED website if we can have training courses, mobile apps on equality in health. What are 2 trends in high impact training? I don't really know that. Is the new nomenclature a waste of time? No, I don't think so, personally. I think we really need a nomenclature that brings us all together, and the idea is that this new nomenclature will bring regulators, industry, CMMS, inventories, procurement, and anyway, we need to link it to the UDI. How can we persuade developed countries to support low and middle income countries? I think as long as they feel they are affected, they can really support. The example is Ebola. So how can we ensure that countries can support, and if we have some specific outcomes? We need permission to reprint parts. No, we don't. You don't need any permission to reprint books for education. You can go to the website, download the PDFs, and just distribute for that. If you want a printed book, then you have to pay for it, and if you want a specific book, you can go to the bookstore. How can you, does the WHO have medical devices working group for the African region? Well, we don't have a specific biomedical engineer working in the African office, but we do have we can create a working group for the Africa region specific. So I will take care of all these questions, we will save them, and then we can work on them. For the Africa region, how can support post-warranty management of medical equipment can be handled well? To medical engineering education meet the global needs? Yeah, I think, well, if we take all these questions, in reality, we can create like we can post them in the CED, we can post them in the WHO website with responses for all of these things, and maybe Stefano or Lorenzo, if you think we can post some of these responses in the website of your Congress, I can respond them and we can post them, no? Because I think it is good. For collaborating centers, to involve them more in its work, we will be sending specific requests. We are sending specific requests to all collaborating centers, but we can do more, and we need more collaborating centers. CA with Frascati Manual of OECD. Well, I'm working with the OECD already, but if anybody can help me on that area, so if anybody can volunteer on anything, please send an email on the specific areas that you want to volunteer, like the OECD. Hierarchical diagnostics and treatment, it could be the hierarchical diagnostics and treatment. We want to link the new nomenclature with the ICD, so that then we can have classification of interventions and classification of diseases and classification of medical equipment. GMDN can be downloaded for hospitals, yes, because they have the GMDN agency before they were, and the UMDNS, so UNSPSC, they had a way of working, and things have changed in the last year. So all of a sudden, since April this year, GMDN became freely available and became downloadable just because we have been pressuring, but this has taken at least 7 years. So that's why we want to work with them just on the mapping, but now WHO will take the lead on the classification, codification, and nomenclature of medical devices, and GMDN can be mapped to them so that if you're using GMDN, you can map to them. To train countries on the orientation guidelines developed by WHO. We would like to have like a training program or videos or so to train, so if anybody wants to help on that, we can do. So I think, well, there will be many questions coming. I don't think we have more time to be answering this, but we really thank you, everybody that has been submitting questions. I'll be glad to respond to them, but maybe also in the website. You tell me, Stefano, how can we do that? No, yeah, just to break this. Can we go back to the presentation, please? And of course, all these questions are saved, so I can go back, and you can still. We will leave it open, so if you want to send any other questions, you can do. Okay, then to the presentation. Okay, so now. The pen, I forgot the pen, but well, anyway, just remember, this is my last slide, but always remember whatever we do is for the patients, is for the population. It is not for the sake of technology, it's not for the sake of us as clinical engineers. It's really because patients really deserve our technical knowledge, but most of us, our passion, transparency in the way we work, very hard work. We all have to work very hard, but we all have to work together. And only if we work together, we can achieve all the goals that we want. So thank you very much. Grazie mille. Thank you. Spasiba.